I like to use not just one particular device when I do lipedema surgery. I have a multi-system approach. To begin with, I use the wall, which is a water-assisted liposuction, in every single patient that I do. But I use it primarily to put the fluid in using the wall. I think it's an outstanding tool for that, to release and hydrodissect the tissue and fibrous tissue using the wall and to numb the area. But I don't feel wall is the best in terms of sculpting and contouring. It's not my tool of choice. I don't think it's very good with extremely fibrotic patients or fibrotic areas, which is common lipedema. I don't think it's the best with lipedema nodules, and I definitely don't think it's the best in a condition like Durkheim's disease, where there's a lot of fibrotic nodules. So I, in many patients, use something thermal. I either use Vaser, which is ultrasonic liposuction, to help emulsify and release fibrosis, or I use laser as a second step after the wall. And then after that, I use something called power-assisted liposuction, which is a vibrational device, almost like a Sonicare toothbrush, that mechanically is outstanding in terms of helping to release and break up the fibrotic tissue, and very, very good for contouring and sculpting. So I use really 3 different steps as I go about doing the surgery, and a variety of different tools. In most patients, I do an average of 2 surgeries. Sometimes it's only 1, sometimes it goes into a 3rd or 4th surgery in very large patients. In the United States, there have been guidelines that we like to keep within. These are guidelines by the American Society of Plastic Surgeons and derm surgeons. And that guideline is trying to keep to within 5 liters with each surgery. So I generally keep within 5 liters with each surgery. I will go past that a little bit. I've removed up to 7 liters in larger patients. I would say the average amount I remove is between 4 and 5 liters in patients with each surgery. Sometimes it's less though. Sometimes patients are smaller, or sometimes they have more swelling or fibrosis, and there's only going to be 1.5 liters or 2 liters removed in a particular patient. I try to remove as much lipedema fat as possible, but at the same time balance getting the best cosmetic results. So in every patient, I'm trying to do 2 things: get the best result from a standpoint of treating the disease itself and prevention of that disease, and the best cosmetic result in every single patient too. And I think the 2 should really go hand in hand. In terms of intervals between surgery, between surgeries, on the average patient with uncomplicated stage 1 or stage 2 lipedema, I will typically do surgeries a week apart. In larger patients or more of a complicated medical history, I'm going to extend that period and do patients 2 weeks apart, sometimes 4 weeks apart, sometimes make a judgment in certain patients with lipolymphedema or complicated histories to do them even more than that, 4, 6, or 8 weeks apart between surgeries.